Good morning, good evening. It depends where you are. I am Sari Hanafi, President of the International Sociological Association. On behalf of this association and the International Science Council, I would like to welcome you all in this webinar about COVID societies, sociologies, and beyond. Let me just say a few words that the surreal atmosphere of the COVID-19 pandemic has exposed fault lines in trust among the human being, among countries, between citizens and government, and it is pushing us to raise big questions about ourselves, our social relationships, and life in general. This crisis is not just limited to public or environmental health or the economy. What we are witnessing today is a moment of truth regarding the crisis of late modernity and its neoliberal capitalist system. We will not be able to simply revert to business as usual after we got through this crisis. And the social sciences and sociology in particular should work to analyze and actively engage in addressing these new realities. I'm so honored to have with us outstanding scholars, but I will leave to our moderator, Professor Greg Calhoun, to present the webinar and moderate this debate. He is just a few words. He is a professor of social sciences at Arizona State University, and of course he was a director of London School of Economics and Political Sciences and the president of the Social Science Research Council, among other things. So I give him the floor.
Thank you very much, Sani Hanafi, and thank you for offering these welcoming remarks on behalf of the International Sociological Association. The COVID crisis, as Sani has already suggested, is one that challenges us in every dimension of society. Sociology appears as an indispensable source of perspectives on the crisis, helping us to understand its many dimensions. There is no single sociological perspective, rather there are many dimensions of understanding. It's also important, and part of the spirit of this webinar, to ask how the crisis challenges sociology. So our interest runs in both directions: how better to understand COVID at large, and how to understand the capacities and the potential paths for improvement of the social sciences. This webinar follows previous discussions focused on economics and psychology, and an upcoming webinar will focus on political science, as the International Science Council explores the ways in which the social sciences play a crucial role in understanding the pandemic and also in the larger project of global scientific understanding. We are very privileged to have as our key speaker today Professor Deborah Lupton, a Sharp Professor in the Faculty of Arts, Design and Architecture at the University of New South Wales in Sydney. Deborah's research is interdisciplinary and spans sociology, communications, cultural studies, but it also has included some other dimensions I just want to highlight before turning this over to her. First, Deborah has been a key thinker about the way in which being human and having a self is transformed in the world of new kinds of data and new kinds of technologies. And this itself is something that appears in the context of the COVID pandemic as we learn a new way of relating to each other and understanding our identities, reliant more and more, as today, on electronic technologies, and producing, whether we like it or not, data selves in a world of surveillance. She's also the author of The Face Mask in COVID Times and has led a commission in Australia looking at the issues of COVID, public health, and society. And distinctively, she is not just describing this, but trying to theorize and understand in a deeper way the coronavirus pandemic. So she's a perfect guide for us to begin our exploration of sociology and the coronavirus pandemic. I will introduce the discussants as we turn to them, but after Deborah's talk, we have very distinguished sociologists to ask questions and initiate a discussion, and then there will be time for members of the online audience to pose questions as well. Deborah, over to you.
Thanks very much for that wonderful introduction, Craig. It's wonderful to be here. Thank you to the organisers, David and colleagues, for inviting me to speak. I'll just see if I can get the share screen happening. Let's just move forward a bit. So. Okay, I just have to go to the beginning screen. Here we go. I presume everyone can see it. Fantastic. So as Craig mentioned, I'm going to be talking about the topic, in fact, have been asked to talk about the topic of researching and understanding COVID societies, sociology and beyond. And what I'm going to do is sort of talk about my background as someone who has been trained and worked very closely in sociology, but also does have experience and training in other cognate fields, and how having a very interdisciplinary perspective throughout my academic career has really helped me understand phenomena such as the COVID pandemic. So my PhD was actually from a Faculty of Medicine at the University of Sydney in the Department of Public Health. And I ended up there because I did a Master of Public Health, having trained in sociology and biological anthropology in my undergraduate training, and became very interested in the social and cultural dimensions of health and medicine and public health. So I went and did a Master of Public Health after I had my initial training in biological anthropology and sociology. And doing the Master of Public Health was very interesting because I sort of was like a participant observer, understanding public health with and through a sort of critical social research lens. Most of the other people doing the Master of Public Health were from medical backgrounds, but I was one of the few people with a sociology background. So it was very interesting for me to learn about epidemiology, biostatistics, health promotion, health economics, already having been trained in critical social science. And I ended up staying on in that Department of Public Health to do my PhD. And that was around the time, I started in 1990 when another, well, in fact, probably the last serious pandemic that affected the global north in particular, the HIV/AIDS pandemic, was very much raging through many countries, including in the global north and in Australia. And there was a lot of stigmatization, a lot of moralization, a lot of finger pointing and blaming that was going on since the first discovery of what was later to be called HIV and AIDS in 1981 in a group of gay men in the US. What I did was I did a critical analysis from a Fagodian perspective, looking at the ways that the Australian press reported HIV and AIDS from the very first mention in 1981 right up through the first 10 years of the pandemic. And that ended up in this book on the left here, which I ended up publishing as a book after I received my PhD, called Moral Threats and Dangerous Desires, AIDS in the News Media. A few years later, I published with my colleague John Tulloch this book, Television, AIDS and Risk. And that image that you see there on the cover is a very well-known public health campaign that was run in 1987 called the Grim Reaper campaign, using this very threatening and horrifying figure of death to try to persuade Australian heterosexuals that they were at risk of HIV and AIDS. And in that book, we talk about those public health campaigns, but we also talk about fictional and dramatic television drama series that had examples of people living with HIV and AIDS. I've also published quite a few books looking at the cultural and sociological dimensions of public health and medicine and embodiment. So these are some examples. Medicine as Culture came out at the same time as Moral Threats and Dangerous Desires, basically based on the teaching I was in my first lecturing position, teaching sociology of health. I brought together historical and anthropological and cultural studies and sociological perspectives examining medicine as culture and illness, disease and the body, as the subtitle says there. I also published The Imperative of Health the next year, Public Health in a Regulated Body, and that built on a lot of the insights I gained studying as a public health student and being quite amazed at the sort of very neoliberal and victim blaming approaches that were being taken in public health in the current era. And I traced a sort of historical perspective on that. I've since published books on food, the body and the self. I'm quite interested in the way that people understood self-worth and embodiment in relation to food intake. Another book on the new public health with my colleague, Alan Peterson. And more recently, I've been writing about fat politics and the way that the obesity so-called crisis really, I mean, first it was the HIV crisis, then it was the so-called obesity crisis that was considered the new pandemic from the last few years of last century well into this century, when obesity became identified as the latest health crisis. I've also written quite a lot about the socio-cultural dimensions of risk. So here are 3 books. One's an edited book, one's the book on the left called Just Risk. So the Key Ideas Routledge series looks at different theoretical perspectives on risk in everyday life, again with John Tulloch, looks at empirical work we did on people's understandings of risk and socio-cultural theory. Looks at, is an edited collection that presents different other people's perspectives on theory and risk. And as Craig mentioned, more recently, I've been looking at digital cultures. So I wrote a book called The Quantified Self that looked at, which I called a subtitle of Sociology of Self-Tracking, which looked at the way that devices and software such as apps were being more and more promoted to people to monitor, measure, evaluate their bodies and promote their health, but also become more productive citizens. I've written a book, Data Cells, which does build on empirical research again, talking to people who have used digital health and self-tracking technologies. I wrote the book Digital Health, Critical and Cultural, Cross-Disciplinary Perspectives, which brought together lots of different approaches and other people's research as well as my own on digital health, including healthcare practitioners' experiences of offering digital health, as well as lay people and patients' experiences of being the consumers of digital health. And that runs a full gamut from people's use of Google search to Google health issues and symptoms and decide whether or not to see a doctor, right through to the more recent technologies such as robotic surgery, 3D printing of prosthetics, as well as the literally tens of thousands of apps that are directed towards health and medical information and self-tracking. Digital Food Cultures brings together my interest in digital cultures and food. That was an edited collection that came out last year. But then COVID, the new infectious disease of the novel coronavirus, SARS-CoV-2, erupted. And because I had decades of research and training in not only doing empirical research into people's experiences of public health and infectious diseases and embodiment and risk, it struck me pretty early on in the pandemic, even before the World Health Organization had announced that that COVID-19 could be characterized as a pandemic, which was the 11th of March 2020. It struck me well before that this was going to be a pandemic that was going to have significant repercussions for the world. And so, given that I had been researching these issues for quite a long time, and in fact throughout my whole career, I was able to quickly think of what would be particularly interesting from a social researcher's perspective. And I published this blog post on the Medium website. called Social Research for a COVID and Post-COVID World, an Initial Agenda, and that was published at the end of March 2020. Also in that month, I thought it would be a good idea to do a special issue, bringing together perspectives from all over the world on how people were experiencing these early, this was still, of course, the very early weeks of the pandemic. It seems a long time ago now, as we're now 18 months into the pandemic. But this was still back in March 2020, when we were really, as social researchers, just beginning to realise the true effects and influences of this new coronavirus and this new pandemic. And I read back this Medium post that I wrote back in 2020 in the early months of the pandemic, and I've actually recognised I've actually gone on to do quite a few things I suggested would be a good thing to research, and so of course many other people have done that. So I was thinking pretty early on about what the crucial issues would be for social researchers, including sociologists, but also people from other areas of social science, anthropology, psychology, economics, political science, and what would be the crucial questions they would be needing to explore, including the lived experience, people's lived experiences throughout the world. Because what became quickly apparent for people who were experienced in social research was the very contextualised nature of people's experiences of the pandemic. Here in Australia, our government shut our international borders in mid-March 2020, and they're only just beginning to open them all these months later, 18 months later. So as an island, huge island continent, we were pretty able to be able to basically isolate ourselves to the extent that we've been called Fortress Australia. We haven't been allowed out. Very few people have been allowed in. So we've been pretty much kept within the borders of our large continent, but even within our own continent, the states and territories, the regions, whether you live in a particular state where there's been a large outbreak, whether you live in a rural location where there's been very few cases of COVID, whether you've experienced long lockdowns or not, has really been very variable just within my own country. And we know that across the world, there's been incredibly different experiences depending on where you live. So I did persuade the editors of the journal Health Sociology Review to do a special, they couldn't do a whole special issue because they didn't have enough room, but we did a special section. We could only include 7 articles into the special section that we were able to publish later that year in 2020. So basically the day after the World Health Organization announced that COVID-19 could be characterised as a pandemic, I contacted the editors of this journal and said, let's do a special section. We put out a call for papers very quickly, and we got about 150 abstracts proposed from lots of different parts of the world. So we then had a very difficult time whittling them down to get down to 7 that we invited to go forward as full papers. But this special section was eventually published later that year, and we made when deciding which abstracts to invite to go forward, we made the decision that we were going to be very international. So we selected papers from different parts of the world without, emphasising too many papers, say, from the global north. So we ended up having contributions from Mexico, from India, from Hong Kong, from the UK and North America, but also from Singapore and from Australia. And we had a good mix of early career researchers and more established researchers as well. So I think we ended up with quite a good collection that did have quite a offer very varied perspectives on what pretty much was the first 6 months of people's experiences of the pandemic in those different countries. At the same time, I and many other social researchers were confronted with the conundrum of how do you do sociological research or other forms of social research, such as anthropological research, when you are used to doing face-to-face research with people and you're used to doing field work involving visiting them in their homes or workplaces or in other field sites, when you are used to doing face-to-face interviews or focus groups, which are the standard ways that many sociologists do their research. I was faced with this problem because before Australia introduced our first lockdown, which was in mid to late March 2020, I had started work on a project that actually did involve going into people's homes. We were interested in doing a visual ethnography of how people use digital technologies in their homes. We've got the ethics approval, we've got funding. I had my postdoctoral researcher in place. We were all ready to go, and in fact we did start in early February, and we did several visits to people's homes in Sydney, and we walked around their homes with them. We talked to them about the digital technologies they had in their homes, about the personal data that were generated with and through those technologies. We took a video of what we called the home tour. But then after only doing a few of those home visits, we were faced with the fact that we couldn't leave our own houses except for essential purposes such as shopping for groceries. And we weren't allowed to go into other people's homes because of the national lockdown that had been implemented by our government. So I was considering, okay, what are we going to do now with our fieldwork? And it made me think that I can't be the only social researcher who was suddenly found myself in lockdown conditions or stay-at-home orders around the world, and who was able to do their planned approach to their social research. So how I dealt with it was I used a digital approach. I created a Google Doc, just using the general software Google Docs, and I called it Doing Fieldwork in the Pandemic, and I added a few reflections there on, well, okay, if you no longer can do face-to-face fieldwork, what are the alternatives? And then I opened it up to my followers on Twitter, and the wonderful exponential sort of nature of retweets on Twitter meant that very quickly this open access resource got shared around the world, and many people started adding their methods, their suggested methods for how to do fieldwork in a pandemic. And these people, again, were from very different backgrounds. They weren't necessarily sociologists, they could be anthropologists, they could be media researchers, internet researchers, cultural geographers, for example, who are very used to doing field work, and we're also facing those kinds of, the same kinds of challenges that we all were facing. So very quickly I ended up editing this open access resource that grew to about 40 pages long and had many, many fantastic examples and suggestions of what to do if you can't actually physically be in the same space as your research participants. And it was fantastic that this resource got shared around the world very quickly. It's been shared on a lot of research groups' websites, university institutions' websites, and it really has grown well beyond my plans for it, I guess, which is fantastic. And it's actually been cited quite a lot already as well by people who are reflecting on, how they ended up changing their methods. So I was really pleased that was able to be a very helpful resource, not only for myself, but for many other researchers around the world. And that little photograph you can see there actually is a screenshot from a video where in our own field work, where we were visiting people's homes originally, we ended up just doing simple video calls using Zoom. And so I just thought I'd put that screenshot from that video just to show you what we ended up doing. It shows one of our participants pointing to their digital devices sitting on one of their little corner tables next to a plant and a light in their homes. And we ended up just doing a live video call with people, and people walked us around their homes with their smartphones or their tablet computers, and we were on the other end. Basically, my postdoc researcher, Ash Watson, was talking to them live as people showed them using video calling around the home, and she just asked them the usual sorts of questions we had been asking them about their use. But what was also really interesting was that because, of course, everyone was working from home or supervising their children studying from home, it meant that we actually were able to document people's use of digital technologies in the home, which we hadn't planned on doing because the whole project was planned well before COVID erupted. But it did mean that we were very quickly able to do this kind of empirical research, actually seeing how people were using digital technologies in the home during lockdown. So we've been able to publish 2 articles already out of that empirical research. As somebody who's interested in cultural artifacts and popular culture, I also decided I would take photographs myself of what life was like for me and people living in the communities I was living in throughout the pandemic. So I've got quite a great visual resource that I can use for talks like these now, or for my blog posts, or even to illustrate some of my chapters or articles. So for example, you know, these are all from Australia, and I think if we can all look at the ways that, I mean, in many countries, libraries have been advocating for people to upload these kinds of photos of everyday life during COVID, and I think they're going to end up being a fabulous resource for researchers and for museums as we come to terms with what everyday life was like, what the material dimensions were like. So I mean, we've got things as varied as in the top image there, that's an Australia Post box with, and it's a little bit cut off, but you can see there's a physical distancing sign saying keep one kangaroo apart from each other, just as that's 1.5, sort of like 1.5 meters away. I found on the right top hand corner, I found a carving just in my local park where somebody had carved into a fallen tree, COVID-19 2020. So that's sort of you know, human impact upon a material object, sort of memorializing the pandemic. Then of course there's the plethora of apps that have been generated in many countries. This is a COVID safe app that I'm just showing there on my own phone, which was a pretty useless app actually, and nobody ever talks about it anymore in Australia because nobody uses it. Posters encouraging people to get vaccinated, and there's a statue there in my local shopping area. Somebody's put a scarf as a face covering, and then there's socks that you could find to sort of I guess celebrate the fact that you're a survivor of the COVID pandemic. So some of these materials I've generated have ended up in books that I've written. So there's 3 books. One of them, the one on the left, COVID Societies, will be coming out next April. So it's in press at the moment. I'll talk a little bit more about that in a minute. Then there's the COVID-19 crisis, which actually ended up being a collection. I mentioned earlier with the special section of Health Sociology Review, we had 150 abstracts that were submitted, and we had many good ones that we couldn't include because we could only choose 7. So one of the editors of Health Sociology Review, Karen Willis, and I went through and selected 17 other abstracts, and we got a contract with Routledge to publish them as this edited collection, which came out in April this year, the COVID-19 crisis, social perspectives. Again, it's quite a, it has a lot of diversity in the contributions. Again, we were looking for contributions that span lots of different social groups and geographical locations. So we have chapters that talk about people with disabilities, experiences of the crisis. We have chapters talking about LGBTQI experiences. We have chapters in Latin countries. We have chapters in the global north mostly, but we also, but within that we have examinations of racism and other forms of stigmatization. So it is really quite a diverse collection in terms of the topics. We have how dating apps engaged in health promotion around COVID, for example. So lots of really interesting perspectives offered there. And then with my team in the Vitalities Lab, Claire Southerton, Marianne Clark and Ash Watson, we wrote the book, The Face Mask in COVID Times. And what we wanted to do in that book was really focus on this particular quite apparently simple object, the face mask, that became imbued with so much symbolic and cultural meaning. and in places like the USA caused so much political controversy. And in fact, whether or not you wore a mask came to signify whether you were a Trump supporter to some extent or whether you were a Biden supporter, because as we talk about in the book, in fact, we open in the book with an account of how when Trump was running for his second presidential campaign last year against Biden, he continually derided Joe Biden for wearing a face mask when he was doing public events. And of course, Trump did eventually end up being hospitalized for COVID, but even when he came out of hospital, he was very open in walking out defiantly without a mask on his face. And he made the mask a very political object in the US, more so probably than in any other country in the world. It just became a signifier of what political side you were on, whether you supported libertarian notions that everyone, should have a choice to do whatever they like to do without big government imposing on them. We have had some of that in other countries, even a tiny bit in Australia, but nowhere near the level that we saw in the US around the Biden versus Trump campaign in particular, and also the protests that went on in the US by anti-maskers. And it's interesting to reflect on the correlations between anti-maskers and anti-vaccination people, because there's a lot of crossovers there in terms of how people don't want to be told what to do by big government. So we actually look at a lot of dimensions of face masks. You wouldn't necessarily think on first glance that there'd be a whole book on the face mask, but we found a lot to write about. We write about the do-it-yourself phenomenon and how the face mask became this commercial commodity on websites such as Etsy, where beautifully handcrafted masks were sold and became one of the most highly selling products on Etsy. But also we have a chapter on the environmental issues of discarded disposable face masks and how they became not only signifiers of showing care for oneself and care for the community that you were protecting from spreading infection, but also people were using reusable face masks to show care for the environment and not to contribute to all the garbage that goes on in terms of being discarded in public places and in the sea. So we have a whole chapter on face mask and care, for example, as well. So there's many dimensions of the face mask that we talk about. We have some images there too that looks at the popular cultural dimensions of face masks. And so COVID societies, as the subtitle there, Theorizing the Coronavirus Crisis. So what I wanted to do with this book, which as I said is in press and will be out in April next year, is I saw a sort of gap in the current literature on the COVID crisis that goes through and systematically looks at the different social theories that we could use to understand the sheer phenomenon. It's such a multivariant, multi-locational, affective and socio-material phenomenon that has influenced so many aspects of people's lives, has influenced politics, has influenced the economies of countries, quite apart from the health effects, the deaths and the disease and the lingering effects of long COVID. So what I wanted to do in this book was, firstly, in the histories and narratives of contagion, basically trace a bit of an arc, historical arc, to examine how the world has dealt with previous pandemics. I go back to looking at the plagues in medieval times, for example, because there are some historical resonances even now with how we think about how we contain contagion. Quarantine, for example, was first developed in response to the plague in medieval times. But I also look at more recent epidemics and pandemics such as SARS, such as MERS, Ebola, Zika, and what the cultural and social responses were to those epidemics and pandemics. I then go on in chapter 2 to look at the political economy perspectives that one can build, sort of a post-Marxist perspectives, and look at the macro political dimensions of COVID. And of course, there are many, many aspects of the political economy critique that one could look at. We could look at how socioeconomic disadvantage has been exacerbated in just about every country because of the effects of COVID, how social groups that have usually been marginalised have been even more marginalised and neglected, how neoliberal politics has continued to want to advise people that it's their responsibility for protecting themselves, not only from infection, but also from financial ruin, even when they've lost their jobs due to state-imposed restrictions. Of course, there's been a huge amount of racism that's gone on, particularly in relation to people who are of Chinese ethnicity or are considered to be Chinese in many countries. So I look at all those dimensions in that chapter. In the chapter 3, Biopolitics and Governmentality, I build on a Foucauldian approach to biopolitics, but also move on to looking at how other theorists such as Roberto Esposito have used biopolitical approaches. Mbembe's work on necropolitics, I also consider in that chapter. Then in Risk Society and Risk Cultures, I go back a bit to my previous work on risk theory, and I sort of argue that the work of anthropologist Mary Douglas, as well as Ulrich Beck's work on risk society, it's now time to sort of reinvigorate those and see what they might have to offer for understanding the COVID crisis and the conditions of the COVID crisis. Then I look at gender and queer theory and think about the ways that gender and queer theory have drawn attention to the ways that some bodies have been represented as disgusting, as infectious, as contagious. And I do draw on a lot of the very important cultural theory work that was done in relation to HIV and AIDS, because there's a lot of differences between HIV and AIDS and stigmatization and victim blaming, but there's also some interesting resonances that one can sort of trace a trajectory of as well. So there was very, very wonderful cultural analysis back in the days of HIV and AIDS when it was really affecting the global north. So I go back to those theories that, again, was something that I was engaging with many years ago when I was doing my own research on cultural dimensions of HIV and AIDS. Chapter 6, More Than Human Worlds, is where I bring in the more than human theory that I've been working with more recently, and particularly feminist materialists, but also Indigenous and pre-Enlightenment materialisms, to understand the ways that nature and culture are intertwined, and human bodies are always already more than human, part of more than human worlds, not only with the natural environment, but with the built environment, with objects such as digital technologies. So I explore all those dimensions because, of course, there was a lot of very interesting discussions, for example, of the way that non-human animals were the vector of infection in the first outbreak in Wuhan in China, such as bats. There was mass slaughtering of animals such as minks. So, I mean, the COVID pandemic has actually affected the way that we think about some animals, because it is a zoonotic infection, and of course it has been linked to climate change and the way that humans have made incursions into the natural world and more and more had interactions with non-human animals, and therefore expose themselves to greater risk of infections of new and emerging zoonotic diseases such as COVID-19. So there's a lot to say there in terms of how humans are part of those more than human worlds. And finally, I just want to draw attention to the sheer complexity, which I have tried to gesture to in this short talk when talking about some of the issues and topics and theories that I've been looking at in the books that I've been writing. But when I've been sitting down to list all the multi-dimensions of experiences of COVID responses, prevention and control, the key factors, as I've titled it there. We have all the social, cultural, political and economic dimensions listed there. We have individual practices, how people deport their own bodies, how they manage hygienic practices, whether or not they wear masks and all those sorts of things, whether or not they get vaccinated. Then we have the spatial dimensions, which are hugely important in COVID control. For example, ventilation, how close you get to people, how long you're in quarantine, whether or not you're in quarantine, whether the borders are closed or open, whether you're staying at home or going outside. There's so many dimensions of spatiality that are part of the COVID phenomenon. Then there's issues of testing and tracing and data, how cases are identified. We know that a lot of countries, the reported cases of COVID are very underreported for a whole lots of different reasons, some of which I refer to there. The way that modelling, mathematical models of future scenarios have been really important in government responses and health agencies' responses to COVID. And then there's all the medical issues, the way that vaccines were developed, the different variants of COVID that have erupted, such as the Delta variant, that's caused a lot of problems here in Australia and many other countries, health system capacity, yes, and all the controversies over vaccines, whether or not people will accept them, which one they want to accept, which they think are better for them, which have fewer side effects. And new drug treatments that are coming out all the time, but also issues around pre-existing immunity and immune responses that we're still learning about, genetic susceptibility. So there's all these things, and even though I'm showing them in very sort of, in very separated columns, they are all of course related to each other and crossover and linked to each other in a very complex network of relationships and relations with humans and more than human agents. So I would like to stop on that note, and I'm very interested in hearing the discussants' remarks and any questions or other comments people may have. Thank you.
Okay, thanks very much, Deborah. As we transition to the discussion's comments, let me just note this has been a very interesting exploration of the personal experience of doing research during the pandemic, but also of culture and personal experience in general. One of the notes in which you ended, that everything is connected, is of course one of the constant sociological messages, all different aspects. And I want to invite our respondents to continue discussion of themes of personal experience, but also to bring in some of the other dimensions of sociology that may be significant. The very personal end of experience is connected, we learned during the pandemic, to very large-scale social organization that could facilitate a global pandemic, issues of travel and infrastructure. Transformations in work were a very basic feature of this for many people, as we saw logistics workers doing delivery, and we developed new senses of frontline work. The transition into the service sector became evident, and the way in which this was structured in class, race, and gender terms became important. There are challenges to institutions. The issue of inequality in society is a recurrent sociological theme that people explore in relationship to infection, to treatment, and to the kinds of work different people do in their exposures. Something that Deborah's face mask work touches on, the social sources of political polarization. Why has this pandemic been so caught up in polarized politics? What's gone on? Why has something that we are all in together globally, it would seem, produced nationalism and geopolitical splits? So my invitation to the panelists is to respond directly to Deborah's talk, and also to bring in other dimensions of sociological analysis as they work on them. We'll go first to Ettore Recci, who is a professor at Sciences Po in Paris, who has been an active researcher in different methodologies, particularly on issues of migration and transnationalism in Europe, but also more recently on COVID itself and the way in which the pandemic has changed social life in France and in Europe. Ettore?
Thank you, Craig. Can you hear me? Yeah.
Yes.
Yeah, thanks for introducing me, and thanks to Deborah for her insightful talk. I'll try to react briefly to some of her reflections and capitalize on them, but I would also like to address one of the two underlying questions that orientate our debate today, and mainly the question of what has been the impact of a pandemic on the discipline itself. So I'll try to step back a little bit from my own research experiences on French society during the pandemic, and trying to reflect on whether sociology has changed and in which ways during the pandemic. Since Robert Merton's time, we sociologists like to highlight the unintended effects of social actions and social events. And I think this is one of the cases is that sociology has been through some unintended effects, and it has somewhat changed. This is my feeling as a consequence of COVID. Some for good, some for bad. For good, I would say that there has been a tendency towards COVID has brought scholars together across. I mean, we are a plural discipline. We are often mired in epistemological quandaries and never-ending debates about methods, about approaches. But the pandemic was a reality check. And we all realize, we all acknowledge that people out there exist, they suffer, and possibly they die because of biological, but also social processes. And I saw people, my own experience was to get colleagues from different research fields getting together and setting up a common research project, as we did at Sciences Po, to study how people reacted, how people lived through lockdowns and the pandemic. A second effect was to urge us to bridge across disciplines. And this is not only for sociologists, I think. There has been growing interdisciplinary research. Just an example, in France, the President of the Republic set up a high-level research or scientific committee to help him set up policies, and that committee also included a sociologist. And this committee regularly consulted with scientists from different disciplines and kind of tried to pull all the threads, all the possible scientific threads, including the social sciences, in this dialogue. I think this interdisciplinary push was not only an intellectual move, it was a very practical and hands-on way of reacting to the situation. And the third effect, I think, goes beyond sociology, and it's my sense is that the pandemic has reinvigorated the role of science in society. Nowadays, we may be surprised, and we may be willing to know more about the no-vax movements that are very vocal all across, especially the developed world. But the mainstream, when possible, got their vaccines and became even more aware on a daily basis of scientific facts. They were counting the number of cases, counting the deaths, following some indicators that were kind of alien to their daily lives before. And they've also acquired, I think people have acquired an increased societal reflexivity. People ask themselves, who are we? Where are we going from here? What is waiting us for the future? Which indirectly brings them closer to sociological thinking. We are all amateur sociologists, but the role of sociology gets reinforced by these enhanced thinking about us as a society. What I see as a negative unintended effects of the situation is that there has been a renationalization of societies. Public health is mostly a government-based fact. Borders have been closed, as Deborah has remarked as well. We have been locked down in closed spaces, and everything has become state-centered to a large extent. Even though the pandemic is global, we've been living even more, and people have been living even more nationalized lives. And sociological research as well has been very much contributing. To the best of my knowledge, there is little, if any, major comparative study of the effect of COVID on everyday life. And this is something we should try to remedy in the near future. I think this is a major challenge for the discipline, trying to pull together studies that are being conducted locally and try to think them through on a global or at least a larger scale and scope. Thank you.
Thank you very much, Ettore, and thank you for bringing our attention to ways in which the very character of the discipline and of work in the discipline may be changed, both with interdisciplinarity, but also with the nationalization of discourse and perspective. This is really helpful and to be pursued. Our next discussant is Maitreyi Chaudhuri, who is a longtime professor of sociology at Jawaharlal Nehru University in New Delhi, a distinguished researcher on issues of feminism and gender, on media, on the practice of sociology itself and its distinctive character and place in Indian society. Because of her interest in teaching, important work on the place of education and the social sciences in a democratic society, which is certainly something that has been challenged in many ways during the pandemic, but also something that has been presented as important. So Maitreyi, over to you.
Yeah. Thank you so much, and I'm so delighted to be here today. Thank you, Deborah, for this absolutely wonderful and comprehensive presentation that you made. I was actually wondering, where I would step in. And, when I was going through your slides and the very many, books and articles that you've written, I was struck by the one thing which was already mentioned when you began, the interdisciplinarity of your perspective, the fact that we have to look at all the other dimensions. And you mentioned the way that the pandemic, while being a global phenomena, played out very differently in different parts of the world. And so you have to contextualize it. The question which I had was, how do you contextualize it? In the sense, the point that I think was mentioned earlier, that sociology is about connections, but how do we understand that connections? In other words, what I was struck by the large amount of publications and discussions that have occurred since the pandemic struck us is there's been a great focus on method. And that's something, Deborah, in your presentation, I too was struck by the whole question of method, the digitalized interaction, the transformations of intimacies and family relationships, etc. But what I feel has been not given the same kind of focus has been the theorizing, and the point that you had that your book, which will be coming out next year, would be theorizing the COVID pandemic. And your outline on the research suggests that the world will never be the same again, that the COVID and the post-COVID societies will be different. But what I had was the question which Professor Hanafi started with, the question that did the pandemic bring about a different kind of global society, or did it intensify existing inequalities and fault lines that were already in place, but that were hidden? That we were so caught up in what seemed to be a very long period of stable world. And in a country like mine, India, where I'm speaking from, a society where there was deep inequalities, but we were so caught up with the world that is flat, that everything, we are all the same now. We all use the Facebook, we are on the internet, and therefore the inequalities were invisibilized. And this issue of invisibilization of both stigma, marginalization, and inequalities occurred because what we were doing is that moving away from basic sociological perspectives to talking about structures and agencies, not as buzzwords, but as ensembles of social relationships. And the question that you raised, the earlier commentator raised about unintended and intended consequences. Because what we have seen here in our parts is that many of you across the world would have seen the migrants walking back. And the fact that we had so many urban migrants was invisibilized not only to sociology, to our consciousness. So all the middle class people who are now using new technology in their homes and therefore were part of a transformed family life and intimacies were also shocked because they were literally cognitively and affectively invisible in our consciousness. Now, if sociology is about understanding, not just an interpretative exercise, but understanding to see what is the relationship between the big structures, neoliberalism, the state, the market, and our everyday consciousness. I was very struck, Deborah, by your focus on selves and the new digital selves. But along with the digital selves, we have digital states and digital corporates. And I was also very struck by the fact, because I too work on the media, but Deborah's interest in cultural studies, gender and media, which are areas familiar to me, the fact that the nature of the media has transformed. And perhaps it's not so globally, it's acutely intense in our parts of the world, where the media has become, instead of a check on democracy, an agent of, or literally an agent provocator of the fault lines and inequalities that we talked about. I think I've taken my time, so I'll stop here. Thank you again very, very much.
Maitri, thanks. That was great. You packed a lot into a short time of comments, starting with the issues of method. This very important question that Sunny also posed about how much are we seeing change versus intensification of trends and structures that were already there. The theme of the visibility of inequality. How much has this made in different settings, structures of inequality visible that were invisible? And then, very importantly, relations across scales of social organization, questions of media. So all really crucial themes. Thank you. And we turn now to our last discussant, Munir Sadani, who is professor of sociology at the High Institute of Human Sciences in Tunis Al-Manar University, a leading sociologist of the Arab world and contemporary Tunisia, but also of some key themes that connect his research in this setting to global concerns about culture, knowledge, art, and religion, all of which I think are important for us in the context of COVID. Indeed, I'm struck by the extent to which artistic response has been part of the way in which people have tried to grapple with this. Deborah showed at least a couple of icons of this in her talk. And also something we haven't discussed very directly yet, the issue of religion and the way in which this has been a part of the understanding of appropriation. So Munir, over to you.
Thank you very much, Craig. Thank you, Deborah, for your presentation. I was very happy that you mentioned some points that I myself discussed in some of my written texts, short texts about or on COVID-19. I wrote my first text by March 14, 2020. And my first point, or my main point, was to see or to demonstrate that COVID-19 is not a sanitary crisis. It is more global than this. And I tried to, even the title of my paper was how to get COVID-19 virus in sociological laboratory, because we had this virus in medical laboratory, traditional laboratory, and then it was very important for us, for sociological scholars and researchers, to put it or to give it to our laboratory. So this is to say that by the first days of the pandemic, my first question was to see how the sociological community will react to this. This is a very crucial question for us in MENA region, in Tunisia and in MENA region, and in the global south, because those communities are very weak, are not well organized. There are a lot of countries where sociological community is not organized, even in association, in national association, and then it was very, very hard to react to this pandemic, because the first part of doing sociology was to reconnect with these people, because we are not going to our faculties, we are not going to our universities, and it was very hard to reconnect with people. And this was a very hard problem for our sociological young community. The second part of my discussion will be in reaction to how do people react to the pandemic, because we saw in our society that there was a sort of denying the existence of the pandemic itself, and people are seeing in popular neighborhoods and even in middle class neighborhoods, they were saying that this is a wealthy people disease. This is not for us. And we are not experiencing this kind of crisis, because we are not in this society which is programmed in the politics of the states and all the health programs and the social assurance programs and so on. So this was very astonishing, even for me, because when people are saying that they are not experiencing this disease or this crisis, that means for me that they are out of the society and out of the networking of public policies and public programs and so on. And for the point of religion, I think that Craig is right to say that people that were saying that we are protected by God, and then we are not experiencing this. And I think that this is very important, because when people are not protected by the state, by the government, they are looking protection elsewhere. And even in imagining that they are protected by God, and they won't be touched by this crisis. And I think that this is a kind of formulating the situation, the very hard situation or the very hard context. This is a formulation which try to find something in the imaginary to be repossessed, because they are dispossessed by all the official strategies and by this kind of struggle between empowerment and disempowerment. The people who were empowered, they are the wealthy people who are living in a wealthy town, where they have science, or at least some means to understand what was going on, and to even material capacities to encounter this crisis. I think that those are different aspects of how to react to the pandemic from the sociological point of view, for a very weak community, sociological community. I have some other points, but I will leave the floor for other participants. Thank you very much.
Great. Thank you, Munir. Again, let me highlight this near the end of your discussion. This issue of the way in which religion figures is very interesting, with the notion that for many people, this is a way to matter, a way to find significance when you are ignored by the state, when you are marginalized by the market. And this connects to the broader theme of inequality, which I think has run through all of the presentations and the talks. You gave this an interesting additional perspective by noting that even experiencing disease is possibly an experience of exclusion or inclusion. It's not just that people who are poorer may have different health effects, it's that they may not understand themselves being a part of the society which deploys the apparatus of hospitals and doctors and health and statistics. And therefore, this connects to the visibility theme that Maitri brought up, that there are people who see the society that has health as a different society. They can certainly die of the disease, but they do not experience themselves as in the society of the disease. Very interesting point. I was also struck by your comment about uneven but often weak organization of sociology in the MENA countries, where it is often nationally organized and transnational connections are weak. And that made me think of the Arab Council of Social Sciences and the work it does, which made me think of the fact that it's based in Beirut and all that has happened in Beirut at the same time as the pandemic. And a general class of the fact the pandemic isn't disconnected from all the other things that are happening such as the crisis and disaster of Lebanon, or in the United States, the Black Lives Matter movement, and Donald Trump as a great exacerbator of the pandemic and so forth. So we don't want to imply it's altogether separate. As I call on Deborah to respond, let me note that from the participants, we've had several questions, though I think the issues of inequality come up most strongly in this. But if you want, in responding to the various comments, Deborah, to consider especially the way in which inequality is both a, if you will, a variable affecting the way COVID plays out and something changed by COVID or highlighted in different ways by COVID, this would be helpful. And other questions concern the distinctiveness of COVID historically. You touched on this in relation to AIDS, risk, the transformation of universities and knowledge, but we have hardly any time. So I think maybe the question of inequality should be at the center of the discussion here.
Thank you, everybody. Really interesting to hear everyone's perspectives and comments. So yes, I mean, inequality is something I focused on throughout all my writings. As I mentioned, one of the chapters in my book on theorizing COVID societies is very much a Marxist-oriented approach, a political economy approach, and there's a lot of inequalities across the world that are identified from other people's research. I live in a very privileged country, and even within the country that I live in, there are many inequalities, many divisions, lack of access to vaccines, for example, for people living in remote communities. Our Indigenous people haven't had as much access to vaccines as privileged people such as myself living in a city. People with disabilities haven't had as much access. So you can see that even within wealthy countries, and of course, particularly in low-income countries. And I was thinking of a recent example. I was listening to a radio program the other day comparing Papua New Guinea, which is a country just to the north of Australia. It's actually the closest country to Australia, compared with Fiji, which is another Pacific country, and how in Papua New Guinea, it's just proved really impossible to get people to be vaccinated because they actually have developed a fatalistic approach. They think that vaccines can't help them, that there's a sort of cultural belief going on there. Perhaps there's some religious belief going on there, bringing in the religious side of things. But there's also that general cultural understanding that Western medicine isn't for them and isn't appropriate for them, and that they can't be helped. And there's a lot of issues of trust there too that I'm not sure if I have mentioned or anyone else has mentioned, but time and again we've seen throughout the pandemic that it's when people lose trust in authorities, lose trust in their government, and often for very good reason. For example, in Brazil or Mexico or the US or the UK for that matter, it's not just low-income countries who have had very poor political leadership, and it's when trust is lost in leadership that often inequalities are exacerbated and people don't do things like turn up for vaccination programs. So I guess I would end on that point, the issue of trust that we haven't really able to cover, but it's something that comes up time and again.
Thanks, Deborah. I'm worried that if I take us on much longer, there will be an issue of trust in the moderator because we've hit the time. But let me ask our panelists if any of them want to bring up any last points in response to these questions. They have used the chat. I'll remind everyone else, if you want to see, Ettore in particular has made two crucial points about inequality and reminded us that there's a complex relationship between international inequality, like the disastrous inequality in vaccine availability, and domestic inequality, which has other factors in an interplay as well. Would you like to elaborate, Ettore?
Yeah. much of what I said is the point I wanted to raise, that is the interplay between country and within country inequalities. They don't align in the sense that there is an ongoing debate in equality research on whether one prevails over the other. It's a debate that spans across not only sociology, but also economics. It's the underlying debate between Branko Milanovic and Thomas Piketty. The idea that between country inequality prevails, I think, is sustained, but what's going on with vaccines and the fact that the developed world is heading towards full vaccination, whereas less developed countries are lagging very, very, very much behind. On the other hand, within country inequality in access to healthcare is possibly less severe in developed countries than it is in developing countries, which further exacerbates the gulf, possibly, or the suffering of people who are the poorest of the poor, who are left behind twice by the lottery of childbirth, of being in poorer countries, and also lacking the kind of welfare infrastructure that has sheltered, especially in Europe. I'm not fully sure about North America, the fate and the mortality risk of the underclass in developed countries.
Ettore, one of the features of this in Europe and in North America, and I think in many settings, is that there has been enormous conflict in those settings where there has also been a relatively effective buffering from the welfare state. Not a class conflict entirely, but a political split that has hampered vaccination efforts and hampered other challenges. We look at Britain or the US and we see affluent societies with strong institutions hampered by political polarization. How do you see this mapping into that inequality?
Are you talking to me, Craig?
Well, I was, but it's okay.
Yeah.
Don't feel that you're the only one to respond. And as we're running out of time, let me open it to others and say also, we have in every country a somewhat distinctive way of suffering in this. So there are common threads, but differences, that political polarization plays out differently just among European countries, my friends. But also Maitreyi's comments were pointed both to a very universal issue of inequality and very specific character it took in the Indian context in relation to the pandemic, highlighting a version of the of inequality, but that was both spatially organized and organized in terms of the kind of work that was performed. If I'm correct, one of the middle class experiences of the sudden visibility of the poor was the sudden absence of certain kinds of services previously performed by the poor. And we've seen versions, of this discoveries. Am I right about this, Major?
Yeah, absolutely. In fact, we had two parallel images being played out in the early days of the pandemic. One was the image of people walking back, and the other was the angst of the middle class, whose the domestic labor was always outsourced to the poor and the marginalized, and they had all fled. They had fled the cities. They were also stigmatized. So we had absurd advertisements, which brought about new technology, saying that now you don't have to pollute or dirty your hands with other people. So you had the most crassest, stigmatized prejudices emerging, particularly during the pandemic. So it was not just inequalities, it was also stigma and prejudices, which also happened with religious minorities and ethnic minorities, that they are the purveyors of this. And therefore, my argument that perhaps it intensified divisions which already existed. The other point I did want to raise, because it was addressed, that what do we do as sociologists to understand this phenomena? Because there is a crisis in knowledge. We have a new media, we have a global internet, but the users are not global. So I get a particular kind of WhatsApp messages which come to me because of the algorithm. They don't go to somebody else. And therefore, this whole question of data and customized information makes the challenge of social science knowledge much more. So in our parts of the world, everybody is an expert, not just on the pandemic. They're an expert on religion, they're expert on caste, community, class, social sciences, the academia. This is a challenge, I think, which plays out differently, but a real challenge for sociology.
And let me underscore, it's a challenge that plays out differently, but a challenge that is faced in many places. Yeah. The questions of disinformation or accurate information, or whether research-based scientific knowledge, in fact, structures not just policy, but prevalent public understanding. These are questions that appear everywhere. Deborah has been active in blogging, for example, as a way to try to reach out to broader publics as well as policymakers. So this has come out. And I think Munir's point about people who do not feel that they are a part of the society that has the health crisis is a connected point. Each of you in different ways have brought up not just material inequality, but a perception or absence of a perception of social inclusion, of in effect being in the same society. We don't have time to take it up, but there's a challenge, I think, for sociology to ask, and I'm going to give Deborah the last word on this, and I'll Munir and then Deborah. Do we need to rethink our concept of society to take better account of these kinds of questions? Do we have a concept of society that just assumes that everyone in a nationally defined society is part of the same society? And do we need to question that? Munir, and then Deborah.
Yeah, I want to raise another point or another aspect of this question of inequalities. There is inequalities within the sociological community in the global sense, but when we have this community in the global north is well organized, they can have access to information, to data, and but my experience in here in Tunisia and in the MENA region, some universities and some centers of research, some laboratory of research managed to have connections via Facebook pages and via internet, other internet connections to organize some conferences. And I was personally invited to give conferences in Morocco virtually, but in Morocco for Moroccan universities, Algerian universities, Iraqi universities, Egyptian universities, and I was very interested to discuss this issue of pandemic with colleagues and with students, because students were attending. But at the moment, to raise again this question of in which society are we living? At the moment, I was saying we are talking to whom? As sociologists, we are giving some insights, some analysis, but who are hearing us, who are dealing with our questions in governments, in parliaments, within sociologists, and within the people who may be interested by our analysis. So I think that we are experiences an outstanding experience to reshape our vision of society, of sociology, of doing sociology. And I think that Deborah raised a lot of questions and a lot of remarks who are going in this sense. Thank you.
Great. And so appreciation, Deborah, for your contributions to this effort to help sociology in its transformation in this context. Closing comment from you?
So, closing comment. So I would go back to that very last slide of mine where I tried to show the complexities of the phenomenon that is the COVID crisis. I mean, that the point, I guess the point, if we take it back to what is COVID societies, well, they're constantly changing and they're very unpredictable. And I think that's something that we in Western societies are really, the extended and prolonged and changeable nature of the crisis, where we can't make plans, where we don't know if we'll be in lockdown. I mean, we've certainly experienced that in Australia, where we don't know if we can visit people in other parts of our country, family members. Time and again, plans have been changed because of new outbreaks. So I think that I think that's something that's quite unique for many people living in wealthy societies, that we are dealing with this prolonged sense of uncertainty. So I think that's something that we now share with people who might have grown accustomed to living in war-torn countries or where, you know, there's serious problems with health routinely, where there's high rates of childhood deaths and so on. We in the West are now facing those kinds of uncertainties really for the first time in many of our lives. So I think that's something that does unify in some ways global society. But the reason I called my book COVID Societies and not COVID Society, you know, I wanted to depart from Ulrich Beck's, you know, generalizations about risk society, because he was subject to a lot of criticism for not recognizing the differences. So I absolutely think that sociologists do need to be constantly aware of the changeable nature of this crisis and the fact that it is so uncertain that it's very hard for anyone to make predictions about what post-COVID societies will be, because we're nowhere near that yet.
Okay, great. Thanks, Deborah. And let me thank you more formally for your remarks, and thank sorry for his welcome, the discussants at Theorizing, Maitreyi Chowdhury and Munir Sandani, for their different comments, which enriched this discussion. Above all, thank the International Science Council and the International Sociological Association, our sponsors. And one of the things we've learned is that society is a fragile achievement, and it can be disrupted where it has been achieved, but it's variably achieved, and that goes for sociology and social science. The International Science Council, the International Sociological Association, both work to try to sustain and advance the achievement of social science and of secure knowledge that can be important for guiding us in complex times. Thank you all for participating. Thanks to everyone in the audience. I appreciate your comments.
Thank you.
Thank you.